Dr. Cortes said there had been a great response from the community for oxygen cylinder regulators and described it as a great example of Gibraltar coming together for the common good. He said the GHA Nightingale Field Hospital is now ready and able to take patients if needed, which he described as a major feat in a short space of time, unlike other countries which had struggled to cope in time for the emergency. He said the cemetery niches were ready with capacity for 200 burials, but he hoped they remained empty for a long time. Confirmed cases of Covid-19 remain at 69, with 34 recovered cases and active cases dropping down to 35. However, Dr. Cortes said there were 241 pending results and expected around 80 of them to be positive. He said the measures may be working and we may be slowing down the rate of infection, but this was not a time for complacency, and said we must continue to strictly implement measures. Otherwise, numbers will rocket up and we won't be able to cope. If this happens, he said, loved ones may die.
We will have a clearer indication when we get the pending results back, and we will have a clearer indication when we get the results of our sample of 400 back, because we will be able to see what the prevalence in the community is, and we will be able to see the prevalence divided by age groups, and then we will be able to see where the risks are. So it's early to say. I must comment that judging from what has happened in other countries, I think the increase is likely to come soon. I would say within the next week, but until we have confirmed data, it will be difficult to be absolutely sure. We mustn't get complacent, and if we do hold it back a little bit more, and if the curve does flatten, as we all like to say, well, then that is more reason to carry on with these measures, and it's not a reason to stop.
Krishna Rawal, the acting medical director, said the understanding of COVID immunity was not great at the moment. He said, if you've had the infection, you must continue to follow government advice and guidelines. Otherwise, you could still pass the virus on to someone else. Random sampling at the Rook testing facility will start tomorrow. Dr. Rawal said statistics show a flattening of the curve, but we should still be planning for a surge in cases. According to Dr. Rawal, chloroquine has not yet been prescribed to patients, but the evidence slowly emerging from clinical tests is being monitored, and the GHA has anticipated a worldwide shortage and stocked up on the drug.
We are always watching the evidence and trying to prepare, also mindful of the fact that sometimes when these studies come to the fore, and if they are strong studies that we can rely on, almost certainly there'll be a worldwide shortage of a number of these medications. So we have anticipated, we have stocked up on some of these products already, but at this moment we have not prescribed any for any of our patients at the moment, because we are very mindful of the narrow index when it comes to the toxicity, and we're also trying to understand the evidence behind it. We will not do anything which is experimental on anybody in our community.
As of today, there is ventilating capacity for children under 5 kilograms in the hospital, and there are ventilators which can be adapted to children if necessary. The GHA is still sourcing ventilators for all ages to maximize capacity if there is a surge in cases.